Healthcare issues at Raheen Hospital, County Clare.
Yes. Thank you, Count Corla, for the opportunity to address the House on this issue. Count Corla, I regret to have to say in this House that the HSE, it seems to me, remains a bureaucracy which is completely out of control. It's a bureaucracy which is utterly unaccountable to democratically elected representatives at any level in this country. I would greatly commend the Minister for Health for his moves earlier this year to have the entire board of the HSE resign and reappointed. However, the signal that sent is something that clearly has not permeated down to the HSE representatives in the Midwest region. And that's borne out by recent developments in Clare and in particular in Raheen Hospital. On Saturday the 10th of September, staff in Raheen Hospital were informed by email that the number of respite beds would be reduced from 28 to 23. No discussion in advance, no inquiries as to how that might impact care. Furthermore, they were informed that that would take immediate effect from Monday morning. So patients who thought that they would have a bed on Monday morning learnt on Monday morning that they would no longer have a bed. Count Corla, that is completely unacceptable. As somebody who lives near Raheen Hospital, I was aware that there were difficulties there because the staff had outlined staffing difficulties. I made numerous inquiries to the HSE as to what was happening, and I got no information. This is not about me, Count Corla, but this displays a contempt for the people who voted for me and for people who also voted for Deputy Carey, Deputy Dooley and Deputy Breen in Clare, because they also made inquiries and they similarly received no information. Local councillors in the area made inquiries to the HSE and received no information whatsoever. Yet the HSE persists in this circus of organising meetings, bringing in all the elected representatives into their lovely boardroom in Limerick, where they ply us with generalities, but there's no specific information forthcoming. The HSE was set up by the last government, and it has ballooned into a bureaucracy. It now falls upon this government to deal with it, and I would urge the Minister to deal with it. The HSE, furthermore, was set up to be led and to provide professional health care led by professionals, not by politicians, but by professionals. It simply is not. Professionals are not being listened to in the HSE. Instead, the HSE is being run by bureaucrats who feel that they are, and they display nothing but contempt for this House, the people who sit in it, and for local government. That's further, I think, borne out by what's happened with psychiatric services in Clare.
You have 1 minute.
Thank you, Count Corla. I'm greatly encouraged by the Minister Lynch's comments over the weekend that money would hopefully be ring-fenced for psychiatric services. Because of the 200 psychiatric nurses who were working in Clare 3 years ago, it's now below 150. And there are now rumours that psychiatric care in Tipperary, in particular in Clonmel Hospital, is due to close, and that all North Tipperary patients would be reverting to Ennis. Initially, staff in Ennis were informed that they would receive 14 new nursing posts to cope with this demand. Now they're only expected to receive 5. Indeed, the psychiatric daycare centre in my own town was closed on the 26th of August. It had been manned 5 days a week up until May 2011 and was in 2 days a week since May. Minister, the patients who attend that daycare centre, some of them were not even informed that this was to close. That is simply unacceptable in 2011. Some of those psychiatric patients showed up on the Monday morning expecting to go to their daycare centre, and it was simply closed. Again, Minister, a little bit of communication with elected representatives or with the population would go a very long way.
Thank you,
Count Corla.
Minister, 4 minutes.
Could I just agree with the Deputy in relation to psychiatric services and the idea that a service would be simply closed with the people who are relying on that service and not being informed. That's not right. It shouldn't happen. And hopefully, with the new regime that we're trying to put in place, that it won't happen. I think the days when the psychiatric services are, if you like, part and parcel, are in the overall vote and budget in terms of the acute hospitals, hopefully we will be able to disentangle the funding, and in disentangling the funding, be able to put in place a far more robust system in relation to psychiatric services. I think we have to get away from, and I know there's huge resistance to particular units closing. I'm not talking about day centres now, but units closing down. And I really do think that, you know, we have to move from the bedside to the fireside. You know, people with mental health issues have to be treated in the community and in a far more humane and respectful fashion, not turning up at centres and discovering them to be closed. So I agree with the Deputy entirely. This government is committed to support in relation to Raheen Hospital. This government is committed to supporting people to live in dignity and independence in their own homes and communities for as long as possible. Where this is not feasible, the health service supports access to quality long-term residential care where it is appropriate. We continue to develop and improve health services in all regions of the country to meet this objective and to ensure quality and patient safety. The Health Service Executive has sole operational responsibility for the delivery of health and social services, including those at facilities such as Raheen Community Nursing Unit in County Clare. The Community Nursing Unit is located in a rural area in south-east County Clare. The unit has a total capacity of 28 beds. It can accommodate 14 long-term residents with 12 places allocated as short-term care or assessment beds, and 2 places dedicated to palliative care. The HSE in the Midwest was 20 million in excess of its allocated budget at the end of June 2011. One of the measures implemented to deal with this issue is a reduction in the use of agency staff and overtime across all health and hospital facilities and services in the Midwest. This reduction has impacted on the number of residents that the HSE can safely accommodate. Consequently, the HSE has reduced the number of beds in Limerick, Clare, North Tipperary by 65. These reductions, mainly in short-stay beds, are as follows: 15 beds at Camillus Hospital, Limerick; 17 beds at St Eata's, Newcastle West; 22 beds at the Community Hospital of the Assumption, Thurles; 6 beds at Dean Maxwell House, Roscrea; and 5 beds at Raheen Community Nursing Unit. It is noted that 23 of these beds are currently vacant. It had originally been envisaged that 9 beds would be reduced in Clare. However, through a successful redeployment of nursing staff, this figure was reduced to 5 beds at Raheen. The reduction will be managed with minimum disruption to residents, but I very much take on board what the Deputy is saying, that sort of the planning that had gone into people in relation to maybe respite and long-stay beds. Clearly, that's a huge disruption.
I'm afraid your time is nearly up. You can come back to it and reply.
I will conclude on this, Count Corley. The Deputy will appreciate that all developments have to be addressed in the light of the current economic and budgetary pressures, and any decision taken by the Executive must have regard to this and the current moratorium and recruitment of nursing and non-nursing staff. So
Thank you.
The rest of the reply will be in the record.
Thank you, Deputy.
Count Corley.
Thank you, Minister. You have 2 minutes to respond.
Thank you, Minister. I suppose I'm somewhat encouraged that it had been envisaged that 9 beds would be reduced and that it was reduced to 5. However, I'm reliably informed by the professional nursing staff at Raheen that they are now a couple of nurses short of that required to safely deal with the 23, and yet other health facilities in Clare remain overstaffed, and the HSE in its infinite bureaucracy don't seem to be able to move nurses from one hospital to another. And that problem isn't just confined to Raheen. The lack of information in Innisdiamond Hospital, where the Friends of Innisdiamond Hospital have €500,000 ready to invest in the area, Senator Conway, a Fine Gael councillor from the area, has been unable to receive information from the HSE as to the long-term plans for Innisdiamond Hospital. So when we have exactly what we want on a political level, private partnership and people willing to put their money where their mouth is and invest in local care, they're being stymied by a bureaucracy which is completely secretive. The only information that I could receive about Raheen was a message on my voicemail to say there's a press release going into the domain tonight, the contents of which I cannot share with you. Now, I just can't think of a greater contempt, and it's not for me, it's for the people who vote for me or who bother to vote at all in this country. Minister, I would call upon you to have this issue addressed, and I, for one, have lost confidence in the ability of the HSE to manage our hospitals. I note the programme for government provides that the ownership and management of hospitals will be transferred into boards selected from local people with a local interest in the area, with a genuine commitment, because it seems the bureaucrats of the HSE do not have a commitment to anything other than pushing pens across their desks. And if I sound frustrated, it's because I am frustrated. And that frustration is not something that I alone have. It's shared by all of the deputies in Clare, and I suspect the great majority of the deputies in this House. So I would urge the Minister to move ahead as speedily as possible with the transfer of the running of hospitals from the HSE into boards as provided for in the programme for government.
Thank you, Deputy. Minister, you have 2 minutes.
Deputy, whilst I accept, and obviously the frustration is very obvious, and the movement of the, I suppose, the organisation and the running of different community-based units and smaller hospitals to a board-type structure will in fact ensure that maybe budgets are adhered to and priorities, will be dealt with at that level. Shortage of staff in one area and in excess in others will not be dealt with by boards. And that's clearly something that has to be managed centrally, and the Croke Park Agreement was what that was all about. It's still, and we see it not just in Clare, but in lots of areas in the country, we still see that you have a disproportionate amount of staff in certain allocated areas, and we really need to get down to the task of doing that. And in terms of staff and nurses in the psychiatric area, we are going to lose even more out of the system, but hopefully a different skill mix in the future will give us the type of service that we want. But I do thank the Deputy.
Thank you, Minister.